Welcome to another video. In this video, we will continue learning mental health nursing starting with communication techniques. For the effective outcome of each patient's individualized nursing care, good communication between nurses and patients is necessary. Nurses, on the other hand, must comprehend and assist their patients while displaying kindness and sincerity. They should also spend time to the patient in order to communicate with the appropriate confidentiality. Nurses' physical skills, as well as their education and experience, play a role in effective communication. Therapeutic communication involves active listening. Active listening includes observing the client's nonverbal behaviors, understanding and reflecting on the client's verbal message. There are different techniques a nurse will use to further their active listening skills. One is clarifying technique. This technique uses restating, which allows the nurse to mirror overt and covert messages. For example, the client says, "I can't sleep." The nurse would then say, "You are having problems sleeping?" This is clarifying technique using a restatement. The next technique is reflecting. This provides a means to assist the client to better understand his thoughts and feelings. For example, the client says, "What should I do about my mother's addiction?" The nurse would then reply, "What do you think you should do?" This allows the client to gain an answer themselves. The next technique to learn is exploring. This allows the nurse to examine the client's experiences in more depth and gaining more insight. For example, the nurse would say, "Please tell me more about," and the client would then elaborate. Another technique is asking open-ended questions. This will elicit client responses in more detail. For example, the nurse may ask, "What do you see as your biggest stress factor right now that is making you angry?" The next technique to know is offering self. In this approach, the nurse provides the patient her presence, which is especially important in the most difficult or stressful moments. Staying with the patient while watching TV, sitting with them at a difficult moment, or simply being present may all be examples of self-offering. The nurse may also say, "I would like to spend time talking with you." Another technique is focusing. This is used to gain more insight on a specific, important topic mentioned by the client. The nurse may say, "You've mentioned many events. Let's talk about your wanting to end it all again." While there are tactics that aid the nurse in developing positive nurse-client interactions, there are other measures that should be avoided since they close the nurse-client communication channels. These also make it difficult for the nurse to acquire vital insight into the patient's challenges and problems, and should be avoided. These are known as barriers to therapeutic communication. Examples of these include the following: giving premature advice. The nurse may say, "You should leave your husband immediately." Minimizing feelings. The nurse may say, "Things often get worse before they get better." Giving false reassurance. Like saying, "Everything is going to be fine." Giving disapproval. For example, saying, "I disagree with that." Making value judgments. A nurse may say something like, "Your son is dying of lung cancer, and you smoke?" This makes them feel like they have to say or do what the nurse would agree on or the opposite to get the attention they seek. Well, that's it for this video. In the next video, we will continue the lesson by learning about group therapy. Thanks for watching.